You go to the gym, you eat clean, your body fat is low, your resting heart rate looks perfect. Maybe you even run marathons. And yet, one morning, your heart stops anyway. No warning, no dramatic movie moment, no crushing pain in the chest before it happens. Just collapse. This is one of the most dangerous illusions in modern health, and the part nobody tells you. Some of the people most at risk of a heart attack look incredibly healthy. Because your arteries can hide a deadly blockage while everything still appears normal on the surface. In fact, many people walking around with severe heart disease feel absolutely nothing. They work, train, travel, laugh, and live normally, while a biological time bomb grows silently inside your chest. And for nearly half of all men, the first symptom of heart disease is sudden death. That sounds impossible until you understand how the heart actually fails. Your heart is a biological engine that never gets to rest. It contracts about 100,000 times every single day, pushing blood through nearly 19,000 kilometers of vessels. To keep this muscle alive, the heart needs its own private oxygen fuel lines wrapped around the outside surface. These are the coronary arteries. Think of them as the root system beneath a giant tree. If one of those roots suddenly fails, the branch depending on it begins to die almost immediately. And one of the most dangerous roots of all is the left anterior descending artery, sometimes called the Widowmaker. Not because it sounds dramatic, but because when this vessel closes suddenly, survival drops fast. And what damages these arteries is not just bad food. It is friction, pressure, inflammation, and mechanical stress repeated over decades. High blood pressure acts like mechanical sandpaper. High blood sugar chemically irritates the walls. Smoking floods the tissue with toxins. Chronic inflammation weakens the structure from within. Even years of intense endurance training can create microscopic stress injuries simply from the constant force of blood slamming through the vessels under pressure. Your arteries are alive. They are not static tubes, and every tiny injury forces the body into repair mode. Your arteries are lined with an ultra-thin protective coating, smooth and flexible like a brand new rubber hose. But once that lining gets damaged, your body starts patching the injury with cholesterol particles, inflammatory cells, calcium, and scar tissue. This is where plaque begins. Cholesterol particles, inflammatory cells, calcium, scar tissue, all of it starts collecting beneath the damaged lining like biological patchwork. But here is the misconception that gets people killed. Most people imagine plaque buildup like sludge slowly clogging a drain. They picture the artery getting narrower and narrower until finally blood can no longer pass through. Logically, that makes sense. Biologically, it is often wrong, because as plaque grows, the artery wall can actually stretch outward to preserve blood flow. The vessel secretly expands around the growing plaque. Cardiologists call this positive remodeling, meaning you can have massive plaque buildup while blood still flows normally. No symptoms, no warning signs, no chest pain. You can run a 10K and feel fantastic. You feel healthy because technically blood is still getting through. Meanwhile, inside the artery wall, a hidden biological time bomb is developing, and this is where everything changes in seconds. The deadliest plaques are often not the large, stable ones. The most dangerous plaques are soft, inflamed, and unstable. Imagine an infected blister buried beneath the surface of the artery. A thin, fragile cap covers it. Underneath is inflammatory debris, cholesterol, immune cells, and damaged tissue. Then one day something pushes it over the edge. A sudden spike in blood pressure, intense emotional stress, heavy exertion, a burst of adrenaline, extreme dehydration. The cap tears open. This is called plaque rupture. And the moment that happens, your body reacts as if you have suffered a catastrophic injury. Platelets rush in to form a clot, because biologically your body thinks it is trying to stop bleeding. Normally, that response saves your life. If you cut your hand, clotting is survival. But inside a coronary artery, that same response becomes lethal. The clot grows rapidly until the artery seals shut like a cork jammed into a bottle. The heart muscle on the other side begins suffocating within minutes. This is the heart attack most people never see coming. Not a slow closing pipe, a sudden internal ambush. And sometimes the mechanism is even more deceptive. Imagine a disciplined 50-year-old runner named Tom, lean, healthy, excellent endurance. He runs races regularly and has no major symptoms. During one event, he suddenly feels strange, not dramatic pain, just weakness, nausea, lightheadedness. He assumes he is dehydrated or exhausted. But at the hospital, doctors discover elevated troponin in his blood. Troponin is a protein stored inside heart muscle cells. Think of it like the glowing liquid inside a glow stick. As long as the stick stays intact, the liquid stays trapped inside. But crack the stick and the contents spill out. Heart muscle works the same way. When heart cells die, troponin leaks into the bloodstream. Tom is having a heart attack. But here's the twist. His artery is not fully blocked. It is only narrowed by around 50%. So how does someone have a heart attack if blood is still flowing? Because while sitting on a couch, a 50% blockage may barely matter. The heart can still get enough oxygen to survive normal activity. But during intense exercise, the demand changes completely and requires an enormous surge of oxygen-rich blood. The partially narrowed artery cannot keep up. The heart demands a fire hose worth of blood, while the vessel can only deliver a garden hose. Demand exceeds supply. The heart muscle starts starving in real time. This is ischemia. And in Tom's case, there is another factor involved. Atrial fibrillation. Normally, the heart beats in a perfectly coordinated electrical rhythm. But in atrial fibrillation, the upper chambers quiver instead of squeezing efficiently. The timing collapses. The heart beats faster and less effectively. Now the heart cannot fill correctly, cannot pump correctly, cannot oxygenate itself correctly, creates the perfect biological storm. This is why some athletes die during races, despite looking like the healthiest people in the room. What makes this so dangerous is that symptoms are often delayed. Most people do not feel classic chest pain until an artery becomes severely narrowed, often around 70% blocked. Before that, your body compensates. That slight chest tightness climbing stairs, unusual fatigue, pressure that disappears when resting, shortness of breath that feels slightly off, stable angina. But remember this carefully. Many fatal heart attacks happen in arteries with less than 50% blockage because softer, unstable plaques rupture more easily than hard and stable ones. Your body can hide danger unbelievably well, but it also has a hidden survival mechanism. Collateral circulation. Your heart can actually grow backup blood vessels over time. Think of your arteries like highways. If traffic stays blocked long enough, the body starts building side roads, tiny detours. This is one reason older people sometimes survive heart attacks that kill younger people. The older heart had time to build alternate routes. The younger heart often didn't. And one of the strongest triggers for building these backup vessels? Zone 2, cardio. HIIT training, regular movement. Exercise doesn't just strengthen your muscles. It builds biological escape routes inside your chest. Your body is not fragile. It is adaptive when you give the system the right signals consistently. And now, we need to talk about the biggest lie in modern prevention. Your blood work looks normal. Standard cholesterol panels do not tell you whether plaque is already growing inside your arteries. They only tell you what is floating in the bloodstream, not what is sticking to the walls, which is why imaging matters. A coronary artery calcium scan, known as a CAC score, can detect hardened calcium deposits hiding in the arteries. The scan takes only minutes, but calcium only shows older hardened plaque. The softer, unstable plaques are often invisible there. That is where a CT angiogram becomes powerful because it can reveal the soft, dangerous buildup before it ruptures. Before the ambulance, before the collapse, before the permanent damage begins. In cardiology, there's a brutal phrase doctors repeat constantly. Time is muscle. Once blood flow stops, heart tissue starts dying fast. Within minutes, permanent damage begins. Dead tissue turns into scar tissue, and scar tissue never pumps again. Men often get the classic Hollywood symptoms: crushing chest pain, sweating, pain down the arm. Women are frequently more subtle: extreme fatigue, nausea, dizziness, shortness of breath, even what feels like acid reflux. And sometimes, right before collapse, people describe an overwhelming feeling that something is terribly wrong. That sense of doom is real, The body knows when critical systems are failing. The good news is that your heart is not helpless. Your arteries are living tissue constantly responding to how you live. Control blood pressure because high pressure mechanically tears the artery lining over time. Control blood sugar because chronic glucose spikes fuel inflammation and destabilize plaque. Stop smoking because tobacco accelerates vascular damage at every level. Keep moving because movement improves blood vessel flexibility and helps build collateral circulation. And most importantly, stop assuming you are healthy simply because you look healthy. The human body is incredibly adaptive. It can compensate for hidden damage for years while giving you almost no symptoms at all, until one day compensation runs out. The healthy heart attack is almost never random. It is usually silent damage finally reaching a breaking point. Once you understand that, you stop trusting appearances and start paying attention to the biology underneath them. So, after hearing this, do you still think looking healthy means your heart is actually safe?